GE Healthcare is proud to sponsor the Donut of Destiny podcast. GE Healthcare is the leading global medical technology, pharmaceutical diagnostics, and digital solutions innovator, dedicated to providing integrated solutions to make hospitals more efficient, clinicians more effective, therapies more precise, and patients healthier. Learn more about our CT solutions at the GE Healthcare website.
Hello, listeners, and welcome back to the Donut of Destiny, the podcast on all things cardiac CT for anyone interested in cardiovascular imaging. My name is Praveen Ranganath, and I'm a radiologist from Dallas, Texas. On today's episode, we have a special treat from the first committee at SECT, that is the Resident and Fellow Trainee Committee, which has contributed a ton to the cardiac CT space. In fact, this podcast itself was born from former First Committee members, Alistair and myself. So as part of this episode, we'll be discussing the trials and tribulations of the transition from imaging trainee to imaging attending physician, specifically focusing on that first year. I am joined by current First Committee members, Dr. En-Haw Wu and Dr. Anam Waheed. Both of them will be providing their thoughts on the transition from radiology and cardiology perspectives, respectively. En-Haw and Anam, thank you so much for joining onto the podcast. Why don't we begin with some introductions? En-Haw, let's begin with you.
Hi, everybody. My name is En-Haw Wu. It's great to be here. Thank you for the very nice introduction. I graduated from the radiology training at the University of Washington and joined the Oregon Health and Science, OHSU, in 2021. And at OHSU, I'm a cardiothoracic image radiologist. And right now, I just finished my 3 years of a radiology attendant.
Fantastic. Thank you, En-Haw. And Anam, how about yourself?
Hi, guys. Thank you so much for having me on here. My name is Anam Waheed. I graduated from Brigham and Women's Multimodality Cardiovascular Imaging Program in 2023, and then joined MedStar Washington Hospital Center and Georgetown University last year. I'm just about 1 year in, celebrated 1 year of working at my job last week, and so it's an exciting time.
Awesome. Congratulations, Anam, on surviving 1 year of attendinghood. Both of you are bringing wildly different perspectives despite all of us sharing that passion for cardiac imaging and cardiac CT. En-Haw, you mentioned you're a radiologist practicing on the west coast of the US, while Anam, you're on the east coast of the US as a cardiologist. So perhaps before we dive into that first year post-training, let's get an idea as to what the differences in imaging training backgrounds were for both of you. En-Haw, why don't we begin with you?
Yeah, my training backgrounds, I was a alternate pathway of fellows in University of Washington. This alternate path consists of multiple years of fellowship. And I finished with a cardiothoracic imaging. In my cardiothoracic imaging fellowship, that's actually during the COVID time. So my co-fellow and I coordinate with things, facilitate studies, and constantly talk to the providers, readers, attending, and technologists without attending on site. The volume was high, and then there's a lot of pneumonia patients, as you know. As a fellows in the cardiac imaging, we actually started at 9 a.m. in the morning and finished around 6 p.m. Most of the time, I finished actually by 7 to 8 p.m. after processing the imaging, interpretation, and reading always by attending virtually, and the preview cases for the next day. It was actually pretty challenging in the first half of the year as I learning the cardiac imaging and also doing other works. I also have to prepare for the board exam due to postponement twice. And in my second half of the year, I worked as a clinical instructor and I finalized some of the study reports. And in the last few months of the fellowship, I've also worked as a attendant level to sign up for report and read out with attendant residents. When I look back, those training independence and then tackle things and issues ourselves and help us mature and hone my clinical skill pretty well. And taking on the role as a clinical instructor helped me to connect with the job as at the university very smoothly, almost without a gap. So that's pretty much my training background.
Nice, thanks, En-Haw. So you've given us a good idea as to what I would suspect the majority of cardiothoracic radiology fellowships look like, with that one big caveat being you trained during the time of COVID. So there's that extra wrinkle, an extra set of difficulties with regards to the fellowship training. Anam, could you speak to your training from the perspective of cardiology, perhaps highlighting some of the differences that En-Haw has described?
Yeah, so my training pathway, I did an internal medicine residency and then a cardiology fellowship, a general cardiology fellowship for 3 years. And then I joined the 2 year multimodality imaging training program at the Brigham. I trained across all four modalities, including echocardiography, nuclear cardiology, cardiac CT, and cardiac MRI during my imaging training, as well as had some exposure to all of those in my general fellowship as well. So we were a high volume center. We had high volumes across all four modalities and a breadth of pathology and different kinds of imaging. And as imaging trainees, we were expected to function as junior attendings, taking responsibility and being involved in all aspects of patient care. We were responsible for triaging, protocoling, supervising the study acquisition, pre-reading all the studies, and once finalized, communicating and coordinating with different services and handling any emergencies that came up in the imaging department. And those are skills that, to be honest with you, I'm very, very grateful for now as a junior attending. That experience really helped me in my first year as an attending. In addition, we were also exposed to the development and execution of new protocols, new technologies, and then execution of research and clinical trials, which allowed me to see a different aspect of imaging and running labs and administration during my training.
Fantastic. Thanks, Anam. What I'm hearing from both of you is actually a resonance in the similarities of your training programs about upholding a very optimized, very high volume imaging service with additional dabblings in other forms of academic medicine. So, with that in mind, let's now talk about that transition from fellowship into your career. Both of you, from what I understand, are in academic positions right now. So, honestly, how was it? How did it go? En-Haw, let's start with you.
Yeah, it's actually overall well for me. As I said before, this in the second half of fellowship, I gradually become a clinical instructor and eventually took responsibility as a nearly attending. I think this process helped me with a smooth transition from the fellow to attending. At the university here, I was actually hired as a hybrid person because I have both body radiology and then chest, which is cardiothoracic imaging fellowship training. And then I found myself fit very well in cardiothoracic imaging, so I eventually moved graduate to it. Meanwhile, cardio imaging is a little bit more complicated than the regular chest CT. Allow me to say that since we're in the cardio forum here. But fortunately, most of the general workflows and protocols at my current job are most similar to what I had before. For example, our CT protocol for the cornea CTA is almost the same. Our cardiac MRI protocol is generally identical. The plan, those are the protocols basically the same. And the national and international guidelines of the practices also help the cardiac services constant nationwide. There are definitely some challenges. I need to pick up new things, new skills. For example, back in my fellowship training, we have 3D lab person to help me with the valve studies, such as TAVR, mitral valve, CT, and I need to do it now by myself and then make it correctly, efficiently, and consistently. In my current section, we also work with a pediatric cardiologist for the congenital heart disease imaging. I have a training in adult congenital heart imaging. However, reading with a newborn, a very young patient cardiac CT was somewhat a little bit challenging for me initially. And other challenges I have is collaboration with the cardiac readers and reach out to our customer here. Here is actually cardiovascular providers. And then luckily here at the university, we have a dedicated imaging center. And then our partners in the cardiac and the surgical team, they're very collegial. People are very supportive. So I'm lucky in that it's such a supportive environment.
Yeah, excellent. Thanks, En-Haw. I think you've described, honestly, a pretty reasonable and soft transition from fellowship into training, of course, supported by the environment around you. Anam, was your transition as, well, rosy, so to speak?
So, starting your first job is an exciting time, but people say that you learn the most in your first year of fellowship and in different ways than from fellowship. And I think that's true. It was definitely a transition. I felt like, thankfully, my training had equipped me with the knowledge, the technical skills, but there's definitely a transition when you move from one hospital system to another. I had to learn 4 different software systems because I do multiple imaging modalities. So I had to learn one for echo, one for CT, one for MRI. And then the EMR, or the electronic medical record system, was completely different. So I had to learn that as well. And all of those definitely took a little bit of time to get comfortable with. Often, as a new attending, you're also being extremely careful because you don't want to miss anything or make a mistake. And I was no different. Throw in the stress of not being sure that you're manipulating the image correctly because of not being completely familiar with the buttonology or the software. So, you're handling all of these things at the same time, like learning logistics of the new hospital, the software systems. It definitely is stressful, and you're terrified of making a mistake. It also makes you slower and you take more time to complete things. For me, I also had to learn logistics at 2 new hospital systems from the clinical point of view alongside the imaging point of view. So, and from a cardiology patient care point of view, I had to learn how to coordinate a cath, how to send a patient for an EP procedure, who to call to manage those things, handling outside hospital transfers, what is the administrative workflow with that, supervising APPs. In addition, billing is something nobody talks to you about when you're in fellowship and training, but now you have to figure out how to bill appropriately and how to make sure documentation is adequate for billing. So all of that also adds a learning curve to the whole process. And with being careful, learning new software systems, figuring out logistics, I found myself staying quite late at the hospital. My first couple of months, I was often there till 8:39 p.m. and double checking and triple checking everything, and also trying to learn how to multitask effectively because I feel like as an attending, you're often pulled in multiple directions. Thankfully, I had a supportive team around me who helped, but at the same time, there's definitely a learning curve when you transition from being a fellow to a new attending.
I sense a lot of, honestly, more than just junior attendings, but really fellows and senior attendings can resonate with all of these things, that the initial transition is difficult. Despite all of the things that you've learned over the various years of training, this process is hard and it's not really taught very much, if at all. So I want to hear from both of you as to how you dealt with the challenges of this transition. What were the advantages that you gained from training? What was the support system like around you? Or what other things that we haven't mentioned yet helped you through this initial phase? Anam, why don't we begin with you?
So I think having realistic expectations helps. I had been told that by friends and colleagues to expect a learning curve and to know that it is completely normal to be staying late and taking longer to finish things than other people in the first few months. So I knew I was not alone. I also talked to my other co-fellows who had graduated at the same time and were in different jobs across the country, and they were having a very similar experience. So that definitely helped because you felt like, okay, I'm not doing something wrong. This is a common shared experience by everyone across the board. The people around me at my hospital were very supportive. I have to give a shout out to my clinical chief, Gabby Wiseman, and the colleagues around who were always available for a second opinion or helping with logistics. Even on weekends, sometimes I call people like, hey, I need to up triage somebody to the ICU. I need to send somebody for a procedure urgently. Who is the person I need to call and what is the paperwork I need to get done to make this happen? And people were always available. And after a few months, when you've gotten more used to the workflow, the software, know how the logistics work and who to call, things do get a lot better. Another thing that I sort of mentioned earlier was talking to people who are in the same boat as me. I talked to a lot of my co-fellows, but there were also two other attendings who had been hired straight out of fellowship alongside me in our department. And so we would all talk to each other. Having a friendship and a camaraderie with them also really helped, as we were all going through similar things, and also could help each other with logistics or second opinion or clinical things.
Anam, thanks for highlighting how you tackled these challenges. En-Haw, how about you? How did you overcome some of the challenges you faced during that transition period?
When I look back, there's two challenges when I get started I need to overcome. So the first, I need to fill the gap in the skill set that our current job requires. And that was not in my training. For example, like measurement of the valve studies or structural CT. Those are new to me when I get started because I get used to have the 3D lab people help me with those. So realize this is something I need to learn. So I spent time in the off hours and study, reading the paper, and then also, of course, with the help from my colleagues. And I get used to familiar with all the software and the reformats. And then I practice and practice until all the results are consistent and correct. And also, I contact the cardiology valve team who order this study quite often, and I join their weekly case conference and understand why they need this and then how I can help them for their treatment planning. And I found the process was enriching. I understand how the CT formats matter, and also I get to know the valve team very well. And the second challenge is realize I need to establish a connection with our cardiology colleagues. Here's in our imaging services, we shared a workload between the radiology and the cardiology. We need to know our partner and understand how we can help them to treat the patients and work together. With that, I organized a bi-weekly case conference and invite all the cardiac imagers in the institute to join and discuss cases. The responses is very positive. So every 2 weeks, we share the knowledge in the cardiac case, CT and MRI, and discuss cases. And we get to know each other. And during the process, I benefit a lot during this case conference. And also, I'm able to connect with my cardiology friends and colleagues.
So, despite being either from or in cardiology, as with you, Anam, and from or in radiology, as with you, En-Haw, I'm hearing a lot of similarities in terms of how you dealt with that initial phase, transitioning from being a fellow to being a first year attending. A lot of it has to deal with forming those connections, either with your compatriots and your colleagues in the same shoes as you, or with your referents. Very interesting that there's so much overlap, but rather than focus on the similarities and how you were able to transition through, let's now talk about perhaps something that took you by surprise. What was something totally unexpected that you encountered in that first year of being attending? Anna?
So I don't think you realize how protected you are, both in terms of time and responsibilities as a trainee. As an attending, I felt like there are multiple responsibilities that we have, and we're pulled in multiple directions at the same time. So we really have to master the art of multitasking. For example, on my MRI days, I'm also responsible for supervising stress tests, and sometimes in the echo lab or in the nuclear lab, and sometimes you're getting multiple phone calls from all three things that you're responsible for at the same time. Additionally, you're also responsible for finishing up the clinical work, but being in an academic setting, you're also teaching the fellows, you're teaching the residents, you're teaching medical students. So you have to make sure you're maintaining the balance of giving quality education while managing to try finishing up your clinical work in a reasonable time. And then additionally, there's also the added sense of responsibility you feel now that there is no one overseeing your work. So in the first few weeks, even the normal studies you address at a slower pace. One of the things that was most surprising to me is that on my first day as an attending, I spent an hour staring at a normal echo, just trying to make sure that I wasn't missing anything.
Well said, Anam. I feel like many of us can relate exactly to that point of staying long, staring at a normal case, opening it up again, potentially opening up the next day to make sure you didn't miss anything. Totally feel the same way. En-Haw, how about yourself? Any surprises in the first year of being an attending?
I would say get to know the environment and to find opportunity is kind of challenging, a little bit surprise to me. Because when I get started, I know nobody in the cardiac imaging here in the university. And I realized there's such a need for me to know my radiology and the cardiology partners. And I found it a little bit challenging in the beginning. I really wanted to understand the collaboration between the imager services provided by both cardiology and the radiology. And so where I can able to contribute and work further. And the second thing, like Anam mentioned, I think the education part is to know the radiology education and the training program is different from institute. Every institute has its own culture, and then every residency program has its strengths and weakness. And on top of that, on top of the clinical services, I, as attending, also an educator. And then what's my responsibility is to pass my knowledge and experience to our trainee. And I found it's somewhat challenging to finish the work on time while giving the trainees a quality teaching. So it took me a little while to develop my own approach to educate our residents and fellows. But I have to say, during the process, I found this rewarding to work with a trainee.
Okay, excellent. I think we've covered a lot of the components of the juggling act of transitioning from fellowship to junior attendinghood, where there's a variety of clinical and academic things that you need to do while also ensuring that the quality of what we are doing of cardiac imaging is up to snuff, particularly in the absence of any backup, any oversight that we had during fellowship. That said, besides this juggling act, we're often trying to think about what sort of career we're trying to make, what long term trajectory our career in academic and clinical medicine we're trying to put together. So, from both of you, how have you approached the long term growth that you'd like to have in your career? Anam?
To be honest with you, for the first 6 months after starting my job, I was definitely not thinking about anything long term. There's the new job that you're starting, adjusting to everything at work. There's the part about moving to a new city, setting up new systems, making new friends. And to be honest with you, at that point, I was just focusing on making sure that I'm fulfilling my clinical responsibilities well. Even my application for a faculty appointment at Georgetown, I didn't end up submitting it until last month because honestly, I was just focused on the job and clinical work. I had been involved in some projects academically prior to my job, and I was on some society committees for SCCT and ASNIC and ACC since fellowship. Those are the things I continued with, but I avoided taking on more responsibilities initially, at least, because I wanted to make sure that if I said yes to something or I signed up for something, I was able to deliver on it. And it wasn't just a thing of where I'm saying yes to something and then doing a poor job later on. At the 6 to 7 month mark, I felt like I had time to think. So I started becoming more open to projects, both locally and with the societies. And I'm excited to work on those now.
Awesome. Well said, Anam. En-Haw?
Yeah, similar. I think when I get started, I did not have a long-term academic plan, but I was lucky to get involved in the SCCT here, and then the other community, which is NASCI, North American Society of Cardiovascular Imaging, and I joined as a committee in both society. Here, I am the education committee, also with the NASCI, and here's first the committee in the SCCT. And within the institute, I worked as a CT director. When I see there's an opportunity, I volunteer and well, I can do this. So I manage and advise CT services. And the other part, as I am a clinical educator, I help and work with the fellows and publish the case series studies and then help them present talks on the national meetings. That's basically what I do.
Fantastic. I think we have a nice perspective now from both of y'all as to how you tackled the various challenges that come alongside of transitioning from fellowship to first year of attendinghood. And I want to start maybe converting these ideas into actionable advice for new fellows, new attendings that are out there. Anam, what advice would you give to someone that's either about to or has just recently joined their new job?
I think it's really important to not be shy about asking questions. If you don't know something or are ambivalent about a clinical decision, it is better to discuss it with somebody with more expertise in the area or just somebody else with a second perspective rather than make a mistake. You'll find that most people are willing to help and that even experienced physicians ask for a second opinion on complex cases. You also build your own work community that way and develop a pool of people that you can call for various things. Additionally, I think it's also important to be available. If people have questions regarding your patients or want to discuss things with you, it is important to take out the time to do that. It's also important to give yourself some grace, I think. It is okay if you are a bit slower or take a little longer to do things than somebody with 20 years of experience, and there's nothing wrong with that.
Great. En-Haw, how about you? Any practical advice that we can give to potential new job takers?
I think very similar. I would say allow ourselves at least 3 months to settle in ourselves, family, and the work environment. And I will say we need to get involved in the development activities and learn about the development and the direction of the department. And also gradually find opportunities for ourselves. And I think just Anam mentioned being available and find a colleague and a friends when we could ask questions about. And so reach out to the associates and also colleagues that we're not in the same direction, not in the same department. And also will be your close partner in the patient care or academic work.
Fantastic. That aligns a lot with what was told to me when I was first transitioning to. I was told about the three ables, the just being able, being affable, and being available. You're able through your training, right? You learn a tremendous amount of information about how to perform cardiovascular medicine and or imaging through your training. Being affable is just simply being polite to your referents, to your colleagues that you work with, to the various staff that help make the services run. And lastly, being available, as both of y'all are mentioning, taking the time out to make sure that you are able to help care for these patients and address the concerns of your referents. So we've talked a lot about work thus far, but frankly, as much as academia likes to tell us otherwise, work is not all of life. So I want to get perspectives from both of y'all on how you balance life outside of work with work itself. Anam?
So that's absolutely true, Praveen. To be honest with you, I've realized over the years that I need both aspects of my life to be happy. Being happy and fulfilled in my work and on the professional side of things allows me to be a more fulfilled and giving person in my personal life. And being fulfilled in my personal life allows me to give and do more in my professional life. That said, we only have 24 hours in the day, and it is not easy, and it is certainly never perfect, especially in the current era of imaging with patient volumes going through the roof, physicians being asked to do more and more. But I've realized perfect is the enemy of good, so it is important to at least try to not overcommit to things, to proactively take time out for family and friends, and to try take care of one's own health.
Love it, Anam. How about you, En-Haw?
This is not an easy question to answer, but I realize the balance between these two is crucial. I truly believe only when you are internally balanced can you do things longer and happier. So I am learning that as well. For work in radiology, our time is more consistent, like 8 to 5 p.m. Those commonly I will finish my daily work on time. But I like to plan things out. So I preview cases on the schedule for the next day. That's a habit actually I developed when I was a fellow. I'm still using it now. I always plan things out. And doing this, keeping things on the time and on schedule, on being rushed by cases, radiology study relies on good schedule and appropriate imaging protocol. So I also encourage our fellows to do the same thing, to preview cases, protocol them, and plan things out. That helps to release some of the stress on the workday. Outside of work, I'm a father of 3, so quite busy. But I wanted to mention I appreciate my wife's at home taking up kids. But meanwhile, for myself, I would like to try to reserve some time on weekends, take a walk, take a jog on just nearby trail, and then do some casual cycling. And I listen to some podcasts to learn things outside radiology. And I think self-care is essential. Many of us has been through intense post-residency trainings. So it's very important to listen to ourselves, understand what career of life can be interesting us more.
En-Haw and Anam, I think that our conversation has really encapsulated the trials, tribulations, and potentially really rewarding components of that ever-present transition for all of us to go from training into our first job, or really from one job into another. So overall, I think we've really touched on some very important topics, and you both have captured really valuable pieces of information about how to deal with these expected challenges along the way. Before we conclude, do you all have any final thoughts on them?
No, it's a transition is a transition, be it from fellowship to your first job or from one job to the other. It's important to find your community and also take care of yourself alongside.
Thanks, Anam. And how about you, En-Haw? Any final thoughts?
I would say the transition will be something new. Just keep learning, being positive, being available, reach out to friends, and reach out to the society. Meanwhile, I think also take time to take care of yourself and the family, and this will help us your work and make it longer and make yourself happier.
Excellent. En-Haw and Anam, thank you so much, not only for spending your time to give us this insight on the podcast, but your contributions to the FIRST committee, to the patients that you treat in your institutions, and to the cardiac imaging community altogether. Super kudos to you both for what you've done thus far, and obviously very exciting to see what you both are going to continue to do for cardiovascular imaging and cardiovascular medicine. Thanks both.
Thank you so much for having us.
Of course, thank you both again. To our listeners out there, thank you as always for tuning in. We really, really appreciate you tuning into this type of content and helping this type of content get out there to others. Please rate, review, and subscribe to the podcast if you like hearing from Anam, En-Haw, and other leaders like them. We'd love to get more of this content out there, and we rely on your feedback. Once again, this is the Donut of Destiny. Cheers.